ReSPECT stands for Recommended Summary Plan for Emergency Care and Treatment. The ReSPECT process starts with a conversation between the patient and health professional about someone's treatment preferences in an emergency situation when they may be unable to make or express their wishes if they're unwell. The plan created is intended to respect patient preference and clinical judgment. The plan is then kept with that person so that it can be accessed quickly in an emergency when a conversation with the person may be unable to take place. We realised in Forth Valley that care planning could be more individualised, it could be more person-centred, and that there needed to be a shift in balance of decision making that is more towards the person, what treatments they would have wished for, rather than this being something that was primarily the realm of the healthcare professionals looking after the person. And the key component of that was missing was their voice. In fact, one of the questionnaires that we had back from someone that had been through the process was that ReSPECT gives them a voice and a choice, and I think it's absolutely integral to what we're doing that we have that voice.
So without an advanced care plan in place, if a patient is approaching the end of life, or if they lose their capacity or their ability to communicate, there can be a problem trying to work out what the patient wants and what is best for the patient, trying to work out what their needs are and what their plans are for that period of their life if they lose capacity. So it's important that we get some sort of framework built in beforehand so that we have a good understanding of what matters to them.
Potentially anyone could go through the ReSPECT process, but it has most relevance for those with particular health needs, complex or lifelong conditions, or those with life-limiting conditions, or those at risk of a health crisis.
The ReSPECT process gently goes through each part of the patient's wishes. It establishes their diagnosis, their prognosis. It's usually done by the team that know them best, so it could be the respiratory team, the neurology team, the care of the elderly team, or the oncology team. The patient, in collaboration with the team, tells us their wishes.
If you initiate the conversation well in advance, speak to the family and the patient if they have a capacity, then there's a clear document about what they want when they come back to the hospital for any acute illness, or sometimes they didn't like to come to the hospital at all. These type of recommended summary care plan in an emergency situation really helps.
I think it's really important in emergency care because nobody ever expects something to happen, and at the time when you are requiring emergency care, you're not always fully able to express your desires and your wishes.
It's all part of the realistic-based medicine that we would like to provide for every patient, which gives the right treatment at the right time and in the right place for that patient. So sometimes the right treatment in the right place is not always a hospital setting. It may be in the patient's home setting or in their care home setting.
The ReSPECT tool has given me personally some security and reassurance that in the event of a resident not being able to speak for themselves in an emergency situation, that we will still be following their wishes.
I think the process of being able to plan and discuss what people would want and what patient wants is really quite empowering. In the past, we've very much focused on the do not resuscitate form, which is very much about things that we can't do for patients or won't be doing for patients. Whereas the ReSPECT process can also look at what treatments would benefit someone. And I think that's a really helpful conversation. Although we still need to discuss things about resuscitation, it actually puts it into a wider context. And that for me as a GP has been vitally important, particularly when I've been responding to patients who've been in emergency situations.
It's a much easier conversation to have with a person because, to be honest with you, starting out with, well, do you want us to do CPR or not on you, is not only incredibly blunt, but is very black and white and is not really a helpful conversation to have. It's part of it, but there's so much more to what we do in healthcare.
Patients, families and carers have been actually really pleased that you're having these conversations and really pleased that we're asking these questions.
My wife knows what the situation is now, which she didn't before because we didn't speak about these sort of things. It created a discussion between her and I, which we never actually ever had in that regard. So it's helpful in that sense. I'm now in a position where I can say, well, I know I've got a heart problem, I know that it could get more serious than it is, and I know what the steps thereafter that I want taken. And as a consequence of that, I would hope that my wishes will be respected by the medical staff and they'll do what I would like to see.
It's important that families and patients are at the centre of their care wherever possible. All parties know what the other side are thinking at the time, and allows us to work together.
Well, they just chatted and asked what, I wanted for my dad. That I want him to go to hospital, which I didn't because he doesn't know anybody, gets very, very unsettled and very cross with people. And I just felt that, here, he'll be looked after, my wishes will be carried out, his wishes will be carried out, and hopefully it'll be a peaceful end.
Yes, it's a good thing to have discussions about what you want coming at the end of your life, or if anything major happens to you. The whole process was a collaboration between my mother, the family, and the medical staff.
Then I would say, well, it's up to you, of course. If you don't want to do it, don't do it. And if you don't want to think about it, don't think about it. It's up to yourself. But for me, it gives me peace of mind that my children agree with me. I got out of it that I know that I'm at the parting of the ways, that they won't let me get resuscitated or anything like that, that they just let me go, and they're quite happy about it.
In Forth Valley, people have already been through the ReSPECT process. They feel empowered to be at the centre of decision making as they should be. So I'm seeing ReSPECT actually delivering on improving care for people, but all quality of care, but also the outcomes. We've actually had feedback from patients saying this should be rolled out nationally.
I think the pilot's worked very well here. I think it would work very well in other places as well, as long as you keep that patient-centred approach.
Nothing about me without me. The ReSPECT process is a patient-focused document.
It's a great tool for guiding clinical judgment in the emergency setting.
People actually have a desire for it, and when they hear about it, they just want to know where they can get it.